My name is Diane Timms, and I am a maternal-fetal medicine specialist, and I am the Chief of Maternal-Fetal Medicine here at Geisinger. Patients are referred to maternal-fetal medicine for many different reasons. They may be coming to see us because there's been something identified in an ultrasound that we need to follow up on. They may come and see us because the mom has risk factors that could complicate her pregnancy and mean that we need to really optimize her care. Many patients feel upset or stressed out if something unexpected happens and they're suddenly referred to a high-risk pregnancy specialist. So what we want you to know is that oftentimes we're able to look at your baby and establish that in fact your baby is healthy and there is no cause for concern. But I think it's important also to know that if we do find that there's something out of the ordinary happening with your baby, that we're going to be here every step of the way to take care of you and make sure that our whole team wraps their arms around you and you get the best care that you need. Some of the more common things that we'll see on the maternal side, maybe moms that come into pregnancy carrying some extra weight, maybe moms who come into pregnancy with pre-existing medical conditions like hypertension or diabetes. Or we may see patients who have been identified to have fetal complications. So for example, if you have a twin pregnancy, you would come and see us so that we can make sure that we take care of all three of you. So to prepare for your visit, you'll want to make sure that you come with questions so that by the time you leave here, you can feel really confident about whatever situation may be happening with you or your baby. It's never a bad idea to bring someone with you to your appointment because sometimes it is really hard to remember your questions when you come and you're a little bit overwhelmed by meeting new people and having the ultrasound. So I think to have a support person with you is always welcomed by us and hopefully will help you to feel more comfortable and make sure that you leave here satisfied. You'll be brought back to your room by a medical assistant or a sonographer. One of our sonographers will meet with you and make sure to review your history and the reason why you've been referred to our office. Then you'll have an ultrasound. And at the conclusion of your ultrasound, if it's your first time visiting with us, one of our doctors will come in and review the results with you and discuss any follow-up that might be needed. If there's a problem with your baby, we'll spend a lot of time reviewing the images with you, explaining what we think is happening with your baby, and making sure that we establish a follow-up plan that will include you, your baby, and your whole family. Having a baby that's affected with any kind of an unexpected abnormality can be a really stressful time, and we want to make sure that we have a whole team that's working with you to ensure the best possible outcome. So we have other members of our staff, like our genetic counselors or our navigator in the Center for Prenatal Pediatrics and our pediatric specialists who will all come together to make sure that we are taking good care of you and your baby. We really want the experience at MFM to be a positive one, and most people will leave here feeling very relieved that even if there is a complication, that we have a plan and that they're in good hands.